Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. And on behalf of the Joint Task Force, I want to welcome you to the update for February 4th, 2021. We have some special guests with us today, so we're very happy to have those guests with us. So first, I'm going to give a few updates on data, probably not as extensive as we typically do. I also want to give some updates on vaccine distribution and what we can anticipate in the weeks to come. Dr. Randolph's going to then join and give some updates from his perspective and particularly talk about the importance of everyone having equal access to vaccine. And then we have guests from the Mexican Consulate that have come here all the way from Little Rock. So our speaker today will be Rodolfo, and he'll further introduce himself. I honestly don't want to incorrectly pronounce his name. So he's going to introduce himself and really share from his perspective what's happening in promoting the access to vaccines across Western Tennessee, Arkansas, and Eastern Oklahoma, but particularly saying here why it's important for our Latino community to know they have access to the vaccine and for us to be able to provide it to that community. So we're very excited about our visitors being here today. So we're still going in a positive direction with our data. We're very pleased with that. As of this morning, we have 83,709 cases, and that's an increase of 220 in a 24-hour period. We have been averaging over the past week somewhere around 300 cases per day. It goes up and down a little bit, but continuing to go on a slow but steady decline at this point post-holiday surge, so we're very pleased again with that. Our reproductive rate has remained below 1, and that's positive as well. Unfortunately, with our current deaths, we're at 1,318 deaths, and that's increased slightly to 1.6 overall mortality rate. We had been fairly steady at 1.5% throughout the pandemic. Our hospitals are doing well. We do know this time of year that typically we would see flu, but we're not seeing much flu. And so we know that the hospitals are able to care for the individuals who are presenting. As far as public health capacity, while we're continuing enforcement and contact tracing, clearly all of our efforts are on vaccine. So I want to talk a little bit about what's been going on this week and then what we can anticipate in the upcoming weeks. We've had multiple sites open across the county this week. Some of those have given first doses, some are giving second doses, and information can be accessed at shelby.community, and appointments can be made there as well. Primarily, we have been at the Pipkin site, and we've been doing some first and second doses at that site. The Germantown site has focused primarily on second doses, and the Appling site has also been able to deliver first doses this week. We're very pleased to announce the Southwest site will open tomorrow, and that's at Southwest Community College. As I've noted before, we're continuing to scout a permanent site in the Fraser area in our hopes that we can identify and name that site relatively soon. But also what we anticipate in the upcoming weeks is that hospital partners and safety net partners will also offer vaccine. We know that Walmart began offering vaccine this week, and then other pharmacies will come on board at some point in the future. So that the ultimate vision is to have a model that is equally distributed across our community so that people can readily and easily access vaccine when their phase or the phase that they're eligible to get vaccine is opened up. So again, we're going to talk a little bit more about vaccine today, and then we'll turn it over to our guests. Thank you. Dr. Randolph, I'll turn it over to you.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. This is Dr. Bruce Randolph, Health Officer with the Shelby County Health Department. I just want to go over just briefly a summary of some data that we have analyzed as it relates to vaccinations as of February 2nd, 2021. One thing I want to emphasize is that we certainly are committed to making sure that everyone have the opportunity and the choice to receive the vaccine. But looking preliminarily at some data based on 13,161 vaccinations that occurred among ages 75 and plus, we find that 60.9% of those were female versus 39% male. When we look at the demographics by race, we find that of those 13,161 vaccinations, 1,564, which represents 11.9%, were given to African Americans or blacks. 6,576, which represents 50%, were given to whites. And then another 2,199, which represents 16.7%, was given to other multiracial, and 2,822, which represents 21.4%, was unknown. And when we look in terms of vaccinations by ethnicity, and this is ages 75 plus, we find that only 47 of those 13,161 was given to a Hispanic or Latino, which represents 0.4% of the vaccinations that was given, compared to 7,911, which represents 60.1% of non-Hispanic or Latino, and then 5,203, which represented 39.5%, which was unknown. So, as you can see, there's some work we have to do in terms of making sure that there is not a disparity in the vaccination and administration of the vaccination. When we look even in terms of municipalities, we find that in the city of Memphis, vaccination rate per 100,000 is 1,058, compared to Germantown, which is 5,450 per 100,000, compared to Arlington, 3,168 per 100,000. So we have work to do. We're just beginning. Now that we're moving into expanding the phase to 70 plus, we would have more people. But because you can see that there's a obvious disparity in terms of our Latino and Hispanic community, it is very important that we reach out and do what we can to encourage and include our fellow brothers and sisters from the Hispanic and Latino community. Therefore, it's a pleasure for me to introduce to you our guest today, Mr. Rodolfo Arenas from the Consulate de Mexico, and he is here to present to us, and he's here to help us.
Gracias. Hello to everyone. I would like to start saying thank you, Dr. Alisa and Dr. Randolph, for giving me this opportunity to talk with all of you. To the government of Mexico, the health public is a high priority. All the Mexican consulates in the United States, 50 of them, are working with the federal authorities, with the state authorities, and with the local authorities regarding this pandemic. Last month, a statement of a governor of Nebraska created a big commotion in the Mexican community in Nebraska and, of course, in America. He said that the meat-packing workers undocumented in Nebraska will not have access to the COVID-19 vaccination. So the Consul of Mexico in Omaha sent a letter explaining the importance of the Mexican workers in that particular industry. I don't know if you have this information, but in this industry, there are more than 26,000 people working, and more than 50% are undocumented workers in all the United States. So yesterday, or the day before yesterday, we received an information by the Office of the Governor of Nebraska that, of course, the undocumented workers in that state are essential workers, and they are going to receive the vaccination without any problem. There was another statement by another governor from Colorado who said that the people who are in jails, in prisons, will now have an equal access to get the COVID-19 vaccination. So we're working as well with this governor, and everything is clear right now. But let me share with you that last Monday, the U.S. Department of Homeland Security published a press release in which it said that DHS and its federal government partners fully support equal access to the COVID-19 vaccines and vaccine distribution sites for undocumented immigrants. It is a moral and public health imperative to ensure that all individuals residing in the United States have access to the vaccine. And also, very important, is another paragraph on this press release who said that the Immigration and Customs Enforcement, ICE, and Customs and Border Protection will not conduct enforcement operations at or near vaccine distribution sites or clinics. ICE does not and will not carry out enforcement operations at or near healthcare facilities such as hospitals, doctors' offices, accredited health clinics, and emergent or urgent care facilities, except in the most extraordinary of circumstances. This, dear friends, shows that public health is a fundamental right for everyone, regardless this immigration status or regardless the color, language, or religion of everyone. So I just came to here to reaffirm to Dr. Alisa, with whom I had a video conference last week, to offer the hand of the Mexican consulate to work together in order that all the Hispanic community living here in Shelby County can get the proper information. There is a lot of misinformation, and we need to work very close with them, not only regarding the legal immigration status, but also, and very important, is the effects of the vaccination. So, Doctor, thank you very much for all you are doing, both of you, and thank you for giving me the opportunity to say some words with you. Gracias.
You want to speak Spanish?
En Spanish.
Yeah.
Sí, muchas gracias. Perdón, no me quité esto. Queridos amigos, solamente quiero agradecerles a todos ustedes la oportunidad que me brindan para dirigirme y decirles que el Gobierno de México tiene un interés muy particular en ofrecer asistencia en materia de la pandemia a todos ustedes que viven aquí en el condado Shelby. Mencioné que hay un gran temor, un gran miedo por parte de la comunidad hispana a recibir la vacuna, primero por su estado migratorio, porque no tienen papeles, y segundo por los efectos que estos pueden traer una vez que sean ustedes vacunados. El Gobierno de México ha estado a través de su red consular, 50 consulados de México aquí en los Estados Unidos, ofreciendo información apropiada, debida, la información que ofrecen las autoridades federales norteamericanas, estatales, locales. Y quiero decirles a ustedes que el lunes pasado el Departamento de Homeland Security, de Seguridad Interna de este país, emitió un comunicado de prensa donde señala expresamente que no importa el estado migratorio de ustedes para tener acceso igualitario a la vacuna del COVID. Y también, algo muy importante, queridos amigos, las autoridades de ICE, de Inmigración, o las autoridades de Customs and Border Protection, en no podrán realizar ningún operativo migratorio en ningún lugar donde se estén ofreciendo estos servicios, en hospitales, en clínicas, en despachos médicos o en lugares públicos, como lo mencionó la doctora Alisa, como Walmart, que también está ofreciendo esta vacuna. Así que estamos trabajando muy estrechamente con las autoridades del Departamento de Salud del Condado de Shelby. Queremos ser parte de este esfuerzo. Tenemos un interés muy importante de que la comunidad hispana reciba la información debida y que tenga confianza en recibir esta vacuna. Así que muchas gracias. Thank you.
Thank you. Thank you for joining us here today, and I really appreciate the Mexican consulate reaching out to us. And as Dr. Randolph said, this is an area we really can do much better, so we're looking forward to our partnership and making sure, one, that it's clear that everyone has access to vaccine in Shelby County, but also we need to do a better job at getting information out to the Latino community and answering questions that the community may have. And lastly, to remove what are barriers to access. So one of the things early on is we actually said that people might need to show their driver's license or proof of residency. Those are things that we don't ask for anymore. So we are committed to removing barriers to access. So from there, I will open it up for questions.
Hi, Dr. Haushalter, my first question is for you. In your report to the Shelby County Commission yesterday, you said the Tennessee Department of Health had sent a second letter to hospital systems urging them to start COVID-19 vaccinations for the general public, including uninsured persons. Can you provide any more detail about that request from the state and any conversations you've had with the hospital systems?
Sure. So I'll start with conversations with the healthcare systems. First, the healthcare systems have been part of the Joint Task Force from the very beginning. So we have a very strong working partnership locally. Everything from vaccine access to testing access to obviously hospital capacity and the build out of the alternate care site. So we've had conversations along the way. And initially, the healthcare systems had sufficient vaccine to vaccinate mostly their team members and potentially a few of their patients. But they needed additional vaccine to be able to offer to the public as well. And so, as of my understanding and the conversations we've had thus far, the hospital systems are committed to partnering to increase access and distribution sites across the county. Myself, as well as Dr. Martin, will have a meeting with the hospitals tomorrow to see how we can expand access, but also how we can adjust the allocation so that, one, it's predictable for the healthcare systems and how they can know what their dose is per week. So it's predictability, a regular allotment, but also the amount of that allotment, and that way they can more effectively plan. So we're looking forward to that partnership. And your second question, please?
Yeah, you talked on Tuesday about the B117 variant here in Shelby County. With that variant present, are we looking at the possibility of another surge if the strain spreads? And how much would vaccination efforts have to be ramped up in order to keep ahead of the spread of the UK strain?
That's a great question. So one, we focus on containment regardless of what strain it is. But what we put in place locally in partnership with the labs and our other clinical colleagues was a very rapid response for when that first variant case was identified so that we could isolate very quickly. We believe we've done what we can thus far. However, we do know that internationally the UK variant has proven to increase transmissibility, so we'll be monitoring closely. We also are really encouraging those individuals who don't know their status to get tested. That's been, a common point of education that we've provided, but particularly those who live in zip codes that have higher case rates currently, we're really encouraging them to be able to get tested as well. We want to ramp up vaccination efforts regardless of whether we have the UK strain here or not, but it's not just ramping up by getting increased doses locally. We have to get those doses widely distributed. And the health department can't be the primary provider of vaccine. We really want it to be like flu vaccine, where you can get it at a pharmacy, you can get it at a hospital, you can get it at a health department. So actually widening that distribution will help us scale up more quickly so that we can prevent surges, whether it's the UK strain or any other variant strain.
Brad Broders, Local 24.
Yes, good afternoon, Dr. Haushalter. Kind of a perfect segue, what you just said, into my first question. I know it's a fluid situation. More vaccines hopefully will come online soon. I know last month there was talk about it's probably going to take a year to vaccinate the herd immunity goal. Has that timeline changed? And at what point do you think Shelby County can realistically pick up the pace in vaccinating the public?
So we can realistically pick up the pace when we get more vaccine. Now, I know if everyone looks at the numbers, it looks like we're probably not as fast as people want us to be, but I can assure you as doses are coming in, between all the partners, we're getting the doses out. Where there's a little lag is that each of those doses has to be entered into a database, and at this point we've given thousands and thousands of doses. So there is some lag and there needs to be increase in that data entry. And this is not a question you have, but I'm going to share it currently. FEMA visited us this week, and they have sent a team of 26 people here. They'll be here for at least a month, and one of their key responsibilities is to help with that data entry so we can know day to day how much vaccine has been given relative to how much we received, and then as we get more, we can roll that out. So I'm confident in our ability to get it out. We just need to get an increased amount. And you follow up?
Thanks, Dr. Haushalter. You kind of discussed this yesterday in your presentation to the county commission, but what has the health department done or is planning to do to kind of help bulk up staffing and help improve the performance of the call volume at 222 SHOT, maybe transportation logistics for seniors? And is there any VaxQ update of how that's ramping up?
Okay, so let's talk about 222 SHOT first. We're getting a large volume of calls, so the IT team is working on increasing the number of lines, and that also allows that line to transfer to another line, so that allows for more quicker response. We'll be adding some additional staffing as well. We're doing several things around staffing, and I really am thankful to administration as well as to the county commission for allocating resources for us to hire people locally. I think that's a part of our story we don't tell effectively enough, but we have hired a significant number of people to be able to be involved in the COVID response. We'll be hiring somewhere up to about 75 people that can do a variety of things, give vaccine, but also data entry and also assist with the SHOT line. So that will help us as well. So I think that'll be beneficial. Your other question was about the VaxQ. We actually tried out VaxQ yesterday when we had a decrease in some appointments at Pipkin, and that worked quite well. So we'll continue to use that moving forward. Another change that people will see probably in the next month is that the state is moving away from the Sign Up Genius platform to a Microsoft platform, and we'll be transitioning to that platform as soon as the state gives us permission to do so. So all of those things I would say we need to continue to tweak. As our volume goes up, we're going to have lessons learned, and we need to apply those lessons relatively quickly. And lastly, I really am encouraging people who can sign up on the internet to sign up through the internet so that we can save the SHOT line for those who call in. And you also had a question in there about transportation. So there is a small team that's meeting to talk about increasing transportation, particularly for vulnerable populations to the sites, or how we might use those smaller, what we're going to call pop-up sites in the community to help with access. Then we've had a fairly lengthy conversation with TennCare to assist people who are insured through TennCare, because they do have transportation through TennCare for their ability to access. So more to come on those as well. And that was probably more than 2 questions, but that's okay.
Kelly Roberts, WMC.
Hi there. My first question is about our weekly allotments, and this is following up from a concerned caller that we had, an administrator at the Pipkin building. Concerned that there were a lot of first doses at the Pipkin building over the last couple of days. I know that it's been kind of dedicated to second doses there. Our weekly allotment, is it expected that we will give all those out within the week that the department keeps after they are dispersed, or are some held back for second doses? Should there, when there's a site that is focusing on second doses, should there be first doses there if anyone is called up? And you know, with the 70 and older, have things changed with the doses that you were able to open up to that group a little sooner than we were told?
So again, that's probably several questions. I'm going to try to answer them all, and if I don't, please let me know towards the end. So things will change over time. Is that initially, one, we receive first doses and second doses separate. So we have not from the beginning held back doses in the health department for second doses. Everyone will recall that that 9,500 people who received their first dose the first week we had vaccine was anxiously awaiting for our notice that the second doses were available. We initially did not know, because of the transition at the federal level, when we would get those second doses. But that's really not an issue anymore. For every first dose given, we know a second dose will come at the appropriate time to be able to meet the needs of the community. So we're not holding back. The second thing is, over time, what will change is that it doesn't matter if you need a first dose or a second dose. If you have Pfizer and you need Pfizer, you'll get Pfizer vaccine. So you'll see a change in the appointment system to make it easier for people, regardless of whether it's a first dose or second dose, for scheduling. We also anticipate in going to the Microsoft program that when a person gets their first appointment, it'll automatically do the second appointment. So I think that'll improve on that first, second dose piece. We also know that coming on board will be the Johnson & Johnson vaccine as well as the AstraZeneca vaccine. So we ultimately will have 4 vaccines in our community, and we have to figure out how best to manage that so that people can get the vaccine they need or want in the right location. So that'll change as well. But specifically to Pipkin, everyone's aware we had multiple sites doing second vaccines. And Pipkin was slated to give second vaccines, but we recognized that we had openings, so we also offered first vaccines. We are trying to get as much vaccine into people's arms as we can locally, which means we have to be flexible. And that's why VaxQ is important, is that if we have openings, we can use that queue list to give people notice to come get vaccine, whether it's the first or second dose. The goal, again, is to get as much vaccine out as we can with all the resources that we have locally. Then you have a follow-up?
Yeah, thank you. My second follow-up is about Pipkin. We received reports later yesterday, after I think things were running pretty smoothly later yesterday, that there was some backup again, some longer lines, and we had gotten multiple reports. It was because some administrators did leave the job, some of the volunteers, just because of their experience. They're administering those vaccines. Is there any truth to that causing the backup that we saw towards the end of the evening yesterday at Pipkin?
Yeah, so we had used the VaxQ to give notice that we had some appointments or openings available, and that is what contributed to the increase in the lines yesterday afternoon. Again, our goal was to use whatever time and resources we had to get vaccine into individuals. I am not aware of people who left because of their experience. There are people who leave throughout the day for various reasons, whether they're volunteers or staff. And so I don't have any specific reports from yesterday that people left because of their experience. What I do encourage volunteers to do, though, is give feedback on their experience. We're relying heavily not on only our own staff, but also partnering agencies, temporary staff, Medical Reserve Corps individuals, and other volunteers. And so if people have feedback, we're always open to that feedback and encourage them to give it to the site manager so that we can address any items that they may have. This really is a fairly fast-moving train, and it changes regularly. And so it's important that we focus on quality improvement every day at every site so that we can deliver the best and most efficient process to the people of Shelby County.
We are out of time. Are there any closing messages today?
I don't have any, but I was going to invite Rodolfo if you want to make any closing comments.
Thank you very much. Just to reiterate to all of you that the Consulate of Mexico here in Arkansas is ready to work with Shelby County Health Department, and we're ready to provide the proper information in Spanish, of course, not only through this particular means, but along with the newspapers, with the La Prensa Latina, who is a very important magazine here in Shelby County, and another radio stations. It's very important. The Mexicans, as you know, listen very often the radio station, so we are ready to work with all of you. And gracias, doctora Alisa, y gracias, doctor Randolph, nuevamente por darme la oportunidad de dirigirme a toda su audiencia, y cuidémonos, sigamos el protocolo de salud, es muy importante. Muchas gracias.
Thanks, everyone. We'll see you back here next week.